Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning will be on the Milwaukee County Department of Health and Human Services and the Wisconsin Department of Justice. Starting with the DOJ, the Wisconsin Department of Justice is committed to fighting the spread of heroin and prescription drug addictions. In recent years, the rate of prescription painkiller overdoses has increased by 260% among young Wisconsinites aged 12 to 25, and heroin use is on the rise all over Wisconsin. Here to tell us more about preventative measures that are being taken to change those numbers is Johnny Koremenos. He is the Director of Communications and Public Affairs for the Wisconsin Department of Justice. Hi, Johnny.
Thanks for having me.
Thank you for being here.
Absolutely.
And for people who may not know about everything that you do at the Wisconsin Department of Justice, talk about the department and what it is responsible for.
Yeah, so the department kind of has 5 main facets. We're the state's attorney, so we have about 100 attorneys at the Department of Justice that defend the state in lawsuits and protect the state's interests on a legal front. We have crime victim services. We have an Office of Crime Victim Services that provides resources to those who have been affected by various crimes in all parts of the state. We have a Division of Law Enforcement Services. Those folks provide training and set standards for law enforcement across the state. And then a lot of what I do is on the public affairs side of things, our Dose of Reality campaign. But then we also have a division that would handle all the internal workings, making sure, you know, the budget and finance, that aspect of things. And then we have the Attorney General's office. So that would be Attorney General Brad Schimmel, all of the agenda that he wants to push, which a lot of that is preventing prescription drug abuse and heroin.
Yeah, and you did a great job covering all that because that is a lot of stuff. So
yeah,
our goal today is really to kind of hone in on the prescription drugs and the heroin because the headlines every single day, somebody is dying from an addiction.
Unfortunately.
And now that prescription drugs have become harder to obtain and abuse, young people from all walks of life are giving heroin a try. And you're here not only to raise awareness and inform our viewers on measures that are being taken, but you're actually here to really paint the picture of just how serious this is. So statistics suggest that more than 75% of those who try heroin once will use it again. And if you would talk about the challenges that go along with spreading awareness about this epidemic.
Well, I think one of the main things is that there's a stigma attached to addiction, unfortunately. That's one of the things that we want to help is to raise this awareness, let people who are kind of hiding behind their addiction and not making it known, let them know that there are hundreds, thousands of people throughout the state and throughout the nation that are struggling with addiction, that there's nothing to be embarrassed about, that addiction is a disease. You wouldn't make somebody feel guilty for having diabetes or cancer or anything like that. So we need to get away from the stigma that goes along with addiction. So that's one way I think that we tackle this, is we raise the awareness, we let those who are, you know, again, those that are not talking about this, to feel comfortable talking about it, go out and seek help, talk to their family, talk to their friends, and find those resources that are out there that are available to help people get through this struggle.
Absolutely, and so many times you have individuals who have a legitimate injury or ailment and their body just becomes addicted to these very powerful drugs. So sometimes it's not on purpose that someone starts taking it. Yeah, absolutely. So heroin has become increasingly popular and it's extremely cheap. So the scariest part, I think, when you talk about this particular drug is that people could die from using it that first time.
Absolutely.
And they have no idea the level of purity, and drug dealers mix heroin with any and everything.
Anything. Yeah, it could be fentanyl. That's one thing that we're seeing on the streets these days. Really, really, really powerful drug that's thousands of times more powerful than morphine.
Wow.
That's being mixed with the heroin. And you're exactly right. Sometimes the heroin it might be at a 10% purity level. Sometimes it could be at a 70% purity level. So if you have somebody who's using, and they're used to using it maybe at 10%, what happens when they get the batch that's at 70%?
Right.
They absolutely could overdose and die, unfortunately.
Wow, just that simple.
Yeah.
And the number of heroin cases processed by the state crime lab has steadily increased.
Absolutely.
In almost every Wisconsin county.
It has.
That's pretty major. And what are some of the things that someone watching can do to help someone who is addicted? Because that a lot of times is the issue as well. You're looking at someone self-destruct and
Yeah.
you really have no idea what to do.
Well, I think one thing is don't take part in feeding the addiction. I think a lot of times people think that they're helping that person that's struggling with addiction by maybe giving them money or giving them different sorts of financial resources. I think it's important that the person struggling with addiction is confronted and then and comforted and let that person know that you're there to support them and that you want to help find them resources to help. There are resources all across the state. A lot of county health and human services provide resources. So find out where those are. A quick Google search. You can go to our website, doseofrealitywi.gov, and find a list of resources in your area where you can begin to seek help for that individual.
Yeah, and you talked about fentanyl, which is an opiate, and prescription drugs, of course, are a whole nother monster because more than 70% of people who abuse prescription painkillers actually are getting them through their family and friends. So that's a hard scenario.
It is, and that's why it's really important for anybody that has a prescription opioid. If you were prescribed this by your doctor, first of all, only take what's prescribed to you. If it says 1 a day, take 1 a day. Don't start adjusting your dosage. Take it as it's prescribed to you by your doctor, and ask your doctor, Doc, are there other alternatives to treating my pain? Are there other non-opioid types of ways to treat my pain? If not, and if you're prescribed that opioid, make sure that you are storing that opioid safely in your home. There are medication lock boxes that you can buy. You could lock them, in a liquor cabinet. You can lock them in a gun safe. There are many different areas you could store them to keep them out of reach of, children and teens, those who are probably most at risk for abusing them. And then the final thing, when you're done using them, let's say you had a procedure and you needed them for a couple weeks afterwards to get through that pain, get rid of them. They're on our website again, doseofrealitywi.gov. You can go there and you can find permanent prescription drug disposal locations. Most law enforcement agencies throughout the state have prescription drug disposal units. You can go there, dispose of them, and at the biannual drug take-back day that DOJ runs and that the Attorney General hosts, we dispose of those drugs. They actually get incinerated, they're destroyed, and they're not in the hands of the people that could potentially abuse them.
Yeah, and it's not recommended that you flush them down the toilet and things of that nature.
No, the DNR and the EPA definitely don't like that.
Definitely wanted to bring that out.
Yeah, absolutely.
That's a thought that people have, just like, oh, just flush them, but that gets into the system.
It does.
Yeah,
and if you don't have those means, you can always just take them out of the bottle, put them with coffee grounds or dirt or something like that, seal them up in a bag, put them in your trash, and dispose of them that way.
Good to know. The DOJ has a long list of partners in the effort to prevent prescription painkiller abuse here in the state of Wisconsin. I'll name just a few of those just to really let it be known how huge this situation is. The Wisconsin Department of Health Services, the Wisconsin Hospital Association, the Wisconsin Pharmacy Association, the Wisconsin Medical Society, as well as the Milwaukee Medical Society. And that's just like a few,
that's
like
a small,
I said.
Yeah, that's just
but
a
that
sample.
just goes to show you that across the board, all of these agencies are really concerned, and they see a lot of different scenarios as well.
The medical community has been absolutely great over the last couple of years working on this issue. They're taking it very seriously. Those that provide medical services, they don't want to see their patients get addicted, so they're stepping up to the plate. They're taking a lot of responsibility and making sure that they have safe prescribing habits. Actually, the Wisconsin Medical Examining Board just passed new prescribing guidelines that basically take kind of a step back and make doctors kind of take a more holistic view of the patient's pain troubles. And so there's a ton of great great leadership at all those organizations you mentioned, plus others throughout the state. We're really lucky in Wisconsin. Not all states have these types of partnerships going on.
Right.
And we've been really very fortunate.
And you've mentioned several times the website called Dose of Reality. Tell us a little bit more about what can be found on that website.
Yeah, so the Dose of Reality is a prevention campaign. It's about preventing prescription drug abuse. And that's, as you mentioned before, many people that use heroin, they started with the prescription opioid. So if we can cut down on the opioid abuse on the front end, we're hoping that those folks never end up using heroin. So at the Dose of Reality website, you can find all sorts of statistics. There are videos, informational videos, informational toolkits, and then there's a really neat feature, an online ordering portal. Anybody can go on, request access for the ordering portal, and they can download brochures and posters. They're tailored for all sorts of different individuals. You have them for HR professionals that can hang them up in the break room at a business. You could put them in doctors' offices, pharmacies, schools, you name it. There's resources for everybody. And the Dose of Reality campaign also has a series of commercials, both online, radio, and television that are being played throughout the state.
Yeah, and I was going to say you guys really do produce some powerful PSAs, and I've seen many of them, specifically the one that I want our viewers to watch right now.
Sure.
It's basically driving home the message of how serious this epidemic is, and this is sadly a situation that happens to somebody in our country each and every day. Let's take a look.
Mike, I'm heading out to run some errands. Better get up soon. Mike, don't you have to go to work? Mike. Honey? Are you listening to me?
Mike, get up. Mike, wake up. Michael, get up. Honey, get up. Mike, baby, wake up.
Yeah, I can't imagine, you're thinking your teen's sleeping in and they've overdosed on drugs. But like I said, that happens to people every single day.
Every single day. It's very tragic.
Well, recent stats released show that there is a 200% increase in fentanyl deaths from last year. That almost seems unrealistic, 200%. And this, as you stated, is a very powerful opioid.
It is.
Opioid, and that musician Prince overdosed on this particular drug, and I think that it really brought to the forefront what people didn't know about this drug. It's like morphine effects, including illegal drugs such as heroin and oxycodone and hydrocodone. And back in June, the DOJ actually did an article saying what was learned from Prince's death.
Yeah, the Attorney General, he penned an editorial that was printed all over the state on this subject. And one of the biggest takeaways is here you have a very beloved music personality, Prince, and no one knew that this was going on. And I think it just goes to show that this type of disease, addiction, can affect anybody. It doesn't matter your skin color, your socioeconomic level, how famous you are. Anybody can be affected by it, and unfortunately we found that out when Prince passed away earlier this year.
It does not discriminate, that's for sure. And something else that came out of that, another legendary performer, Shaka Khan, said that Prince's death is what really encouraged her to go to rehab along with her sister. So it's unfortunate that you lose people, but sometimes it in effect helps others.
Absolutely, we're seeing a lot of that. Folks that are experiencing this unspeakable tragedy, they're losing loved ones left and right. Those individuals are sometimes our best messengers on this subject. There are some really amazing people I've met over the last few years who are going out into their communities, spreading this message of awareness and saying, don't let this happen to your family, because it is heartbreaking. Learn from my experience.
Absolutely. Well, I thank you so much
for the opportunity.
Traveling all the way from Madison to come to
pleasure.
Milwaukee and share this very important information with us today. It's been a pleasure. Johnny Koremenos is the Director of Communications and Public Affairs for the Wisconsin Department of Justice. And of course, for more information on anything that you've discussed, that we have discussed today, you can log on to doseofrealitywi.gov. And when we return to Our Issues Milwaukee, we'll switch our focus to the Milwaukee County Department of Health and Human Services. We'll discuss the current challenges with the juvenile justice system out of the Milwaukee County Delinquency and Court Services Division with Director Hector Colon. We'll do that right after this.